Welcome, everyone, to the Health In Show, an affiliate program of Homeopathy World Community. It's a joy and a privilege to bring Dr. Mohammed Rafiq to the show today, talking about management of acute diseases. We also have our co-host, Dr. Deepak Sharma of New Delhi, India. And Dr. Rafiq is a gemstone of the Homeopathy World Community. As an author, he has contributed over 100 articles, interacting and encouraging the membership, advising the administration of Homeopathy World Community. He graduated with a BHMS degree from BHMC Balcom in 2001, and he practices classical homeopathy at the Family Homeopathic Clinic in Kerala, India. And he's going to show us a little insight into his personal love of the water, fishing, and give us a metaphor of what it's like to practice medicine. He is also an author and has published many homeopathic books through the publishing house of Jain in New Delhi. He says, be a master of materia medica, rapid prescribing, drug addiction, and its side effects, a homeopathic approach, all about abdominal pain, and many, many more books. He is an accomplished PGNAHI with second rank from the National Academy of Homeopathy, India, Nagpur. And we welcome him today. He has gone through hoops and jumped over hurdles to get here. I believe he asked the police to let him into his clinic. It's late at night, and for some reason, these are the rules over there. And so we welcome you today.
Yeah, thank you, Debbie, for the warm welcome. Yeah, I had even contacted the police to get a permission because here in Kerala, after 9 o'clock, it's very difficult to keep the city offices on, so I had to take permission. Anyway, thank you all for the warm welcome, and good morning to all. Good morning, good afternoon, and good evening to all my friends, homeopathic friends all over the world. So we will start with my topic, that is management of acute diseases. So, we get different types of diseases. So today we are going to deal with only the management of acute diseases. So next slide, please.
You didn't even tell us anything about your home world.
yeah, Kerala is such a beautiful place, It's full of backwaters, coconut lagoons, fishes everywhere. So I have just try to connect it with homeopathic acute management and fishing. There is a hidden link between the both hobbies. Of course, homeopathy is almost hobby people.
It's a life hobby.
Oh, sorry, some error with my Skype.
Video.
I'll just keep it. Yeah, it's okay now. It's okay. So next slide, please.
We're with you. Go ahead.
Yeah, next. Page number 2.
Yeah. We're there. Just go ahead and talk and just believe we are with you.
Okay. So how is curing an acute case? Like it's almost like catching a fish. There is a hidden link between both things. Because both situations need what? Dedication, aim, concentration, patience, and timely decision and quick action. Without all these things, we won't be able to catch a fish. Similarly, we won't be able to cure an acute case without all these qualities like dedication, aim, concentration, patience, timely decision, and quick action. Without that, we will lose the fish. Similarly, we will lose our patients. Patients will go to some other system. It happens in homeopathy. So page number 3. Now, literal meaning of acute. The word acute means something having or experiencing a rapid onset and short but severe course. That is the word meaning of acute. And the word meaning of acute disease is a disease having a rapid onset with intense symptoms and short duration of compliance. Page number 4. Acute diseases in homeopathy. You know, friends, this usage, acute, subacute, and chronic, it is commonly used in medicine, which means acute for a short days and chronic for a long time, and in between that is subacute. But dear friends, in homeopathy, that is not there. In homeopathy, acute is acute and chronic is chronic. Acute is acute from its beginning to the end, and chronic is chronic from its beginning to the end. That is the most important difference we should understand. So the acute and the subacute and chronic in modern medicine is totally different from that in homeopathy. So an acute disease never continues as a true chronic disease. Because acute is acute, it won't become a chronic disease. But the thing is, a suppression of an acute disease, repeated suppression of an acute disease can strengthen the dormant miasm, the chronic miasm inside. So only the repeated suppression of the acute can affect the dormant miasm. So Kent has very clearly said one more thing, that without the presence of miasms, acutes are not possible. That means both are interrelated, even though both are separate things. Now page number 6. What are acutes? Acutes are rapid morbid processes as a result of deranged vital force triggered by some like circumstances, emotional trauma, sensitivity, excessive hardship, bodily injuries, altered surroundings, errors in diet, poor hygiene, physical agents, etc. This can trigger acute diseases. Page number 7.
Can I ask you, when you say the word rapid morbid processes, that's on 6. What is a morbid process? This is 6.
It is an abnormal situation where the morbidity happens. There is possibility for morbidity. It's not morbidity or mortality. It is not sure, but it creates an imbalance of mind, body, and soul. So the symptoms will be expressed, abnormal sensations, there will be abnormal functions and abnormal thinking. So even in thinking process is disturbed in an acute disease, not only physical and functional things. So in general, the person will be disturbed due to the derangement of the vital force. That's what we see in acute. Clear?
Yeah, it's getting more clear because if I look at like a dictionary, we think morbid is a very emotional, mental state of being. You know, melancholy, macabre, worrisome, disturbing. These are all words that are used for morbid.
Yeah, definitely.
Okay.
The whole individual is affected. So all mental, physical, emotional, all spheres are affected. So shall we move to the 7th page?
Dr. Sharma, did you have a comment?
Yes.
Dr. Sharma
Rafiq, just speak very slowly. Speak very slowly, because one of the person in the chat is requesting that you are speed up the slides. You just very slow down and explain the words you are written in the slides. That will enhance the show. Thank you.
So the page number 7, Hahnemann's classification of diseases. So Hahnemann has simply classified diseases into indisposition, the B, dynamic diseases, and the C is surgical diseases. So the dynamic diseases include 2. That is, one is acute and another is chronic. You know, indisposition is the transient explosion of latent sora due to changes in the surroundings. It is not so severe like other acute diseases. Indisposition is very easy to, even without medicine we can manage. Whereas dynamic diseases, which includes both acute and chronic, has to be managed with medicine. And another is surgical diseases that has to be managed by surgeon. But even in that situation, we homeopaths can do. We have surgical remedies, even pre-surgical remedies and post-surgical remedies. So homeopathy has got role in almost all aspects of disease. So the dynamic diseases, which includes acute and chronic. According to Hahnemann, acute diseases are transitory, having a definite beginning and end. So if you make a graph of acute, it has got a beginning, continuity, and it stops immediately. It will either kill the person or the person will be all right after the acute episode. And that is the difference of acute and chronic. So Hahnemann's classified in aphorism 73 of Organon, Hahnemann has mentioned 3 types of acute. The one is individual acute. It's due to the explosion of latent sora or due to acute miasm. And another is sporadic acute caused by some atmospheric, meteoric or telluric influences or unreasonable weather. And the third one is epidemic acute. It's due to violent fixed acute miasm. Epidemic due to violent fixed acute miasms. So these are violent, so it can affect so many people in an area compared to other acute diseases which affect a person individually. Whereas in epidemic, it's violent fixed miasm, so it has the capacity to overcome the resistance power of so many people in an area. And you know, epidemic has got two types. That one is non-recurring type and another is recurring type. In non-recurring, there is only once, or the person will suffer only once in his lifetime, but he may not suffer. Whereas recurring type, he will be suffering throughout every season of infection, epidemic. So these are the two different types of epidemic. And Hahnemann teaches us one more thing, that you have to manage acute with acute intercurrent remedy. There is a wrong understanding among many homeopaths that every diseases can be managed by the constitutional remedy. My dear friends, that type of approach is wrong. Hahnemann has very clearly mentioned whenever you come across an acute disease, take the case, observe the acute totality, and then you give an acute intercurrent remedy or acute remedy. And later on think about the constitutional remedy. Hahnemann has very clearly mentioned that. Do not give directly the constitutional remedy to an acute case, because the constitutional remedy is not homeopathic at that particular time. What is homeopathy? There has to be similarity with the person and the remedy. That is what homeopathy. So in an acute episode, we just try to find out a drug similar to the acute situation. So it is a homeopathic at that moment. And once that acute stage is over, we have to consider the totality of the basic characteristic of the individual and then go to the constitutional remedy. So the page number 10.
We have a comment in the chat. Giza says, do you find the viral flu in the Organon by Hahnemann? Yeah. Is viral flu in the Organon of medicine?
These examples are not actually given by Hahnemann. He has mentioned it because in Organon, even some bacterial diseases are written as virus because it is the old terminology.
Okay.
In old terminology, even viral diseases are written as virus. Sorry, bacterial diseases are written as viruses. Even in Allen's keynote, we can see it. Virus, it is written as, even though the disease is caused by bacteria. So that time, the language was totally different. But Hahnemann has not. I feel he has mentioned about some diseases like leprosy and smallpox, cowpox, like that. But I am not sure whether he has mentioned about viral flu. But he has mentioned about other diseases like parotitis and other epidemics.
Maybe he just calls it germs.
Yeah,
or foreign, something foreign in the body.
Yes, exactly.
But viral flu, I don't know.
Foreign body.
Foreign body.
May
okay.
May not be there. Viral flu.
Thank you, Dr. Sharma.
Okay. So the page number 10. But in practice, we have to consider acute indisposition as an acute. So in practice, acute diseases include acute indisposition. Even though Hahnemann has classified indisposition separately, in practice we have to consider that along with acute diseases. So the first is acute indisposition, the second one is individual acute, and the third is sporadic acute, and the fourth one is epidemic acute, which includes recurring and non-recurring type. Acute miasms are involved in both indisposition, in acute individual diseases and as well as epidemic diseases. Acute miasms are involved. But in epidemic diseases, acute miasms are violent fixed, so it has the capacity to attack so many people in the individual. That's the main difference.
In an epidemic, did you say?
Epidemic.
And maybe you can explain a little bit more detail acute miasma for those who are not familiar with the term.
Yeah, the miasms are the dynamic disease-causing agents which has got the capacity to involve, to affect the individual. It is a dynamic power disease-causing power, so it can affect the vital force, which is also a dynamic power behind every human living body. So this dynamic power can definitely affect the dynamic person, dynamic vital force, and that will cause disease. So all miasms can affect individuals. But whereas the difference in acute epidemic is that the violent fixed miasms, these miasms are so violent that it can affect so many people in an individual. Suppose one miasms attack me. If I have the resistance power, if I have my vital force is strong enough, I will be able to survive the attack. Whereas if an epidemic disease, it may not be possible. Only a few people, those who are having super vital force, only they will be able to survive. Others, majority, 80% or 90% of the people may not be able to overcome that. So these violent fixed miasms can affect almost all people in that area. So it is actually not only related with the resistance power, even the environment. You know, we are living in an environment which can influence our body. So I have seen chickenpox affecting in very hot season. And the moment rainy season starts here in Kerala, we hardly get any chickenpox epidemic cases. So our environment has got direct influence on our body. Body is closely related. Even the moon phases, the climate, the humidity, all these environmental factors has direct influence on our human body. And Hahnemann is the first one to mention all these things. Even he has mentioned about the lifestyle diseases, environmental diseases. So he has mentioned a lot of things. Unfortunately, the modern medical world is ignoring due to the fact that he has come forward with homeopathy. That's what's happening. So we'll go to the next slide, page number 11. Acute related aphorisms. Hahnemann has mentioned about the acute through different aphorisms. In aphorism number 5, he has mentioned about exciting causes. And aphorism number 73, he has mentioned, I just covered already, types of acute. And aphorism 221, he has mentioned about the treatment of acute diseases on the basis of ailments and exciting modalities, and later on managing the case with constitutional remedy. So Hahnemann has very clearly mentioned, do not give constitutional for an acute remedy, acute disease. So first you try to cure the acute picture with the help of exciting modalities, and later on give the constitutional remedy.
I think this is an important point that you're making, Dr. Rafiq,
Yeah.
because
Yeah.
a lot of people might think that you just get your one constitutional remedy and it covers everything that happens to you. And you're really
Yeah.
saying that due to environmental influences, whether it's the meteor that came through the atmosphere in Russia, and now all of a sudden everyone there is in a state of shock or something has happened to them, that influence has actually changed that, so the constitutional remedy is not going to be effective. And then you have to take a new case intake of what's going on with the response of the vital force of the person. Thank you.
Yeah. Even in aphorism 240, Hahnemann has mentioned the same use of acute intercurrent followed by the use of constitutional drug. And in aphorism 262 and 263, Hahnemann gives instruction on the diet in acute diseases. So Hahnemann has mentioned about diet in acute, diet in chronic diseases, and about the environment and about the surroundings, how to adjust these surroundings for in order to make the person happy. He has mentioned everything. Now, importance of management of acute. What is the importance? Why we should manage acute? I have seen many homeopaths saying it's an acute, just give placebo and wait. No, that is very wrong, because it is a fact that many acute diseases are self-limiting. I do agree, but there are many dangerous acute diseases. It can kill the person. It can even affect the future of the person. For example, I have acute parotitis. An acute parotitis can affect it can lead to orchitis. So there is chance for sterility in future. So we should not ignore parotitis. We should treat it. Similarly, many diseases like chickenpox. Chickenpox can even cause pneumonia. It can cause a lot of problems. So we have to manage acute diseases. Even a common cold, it can become encephalitis. So we cannot ignore acute diseases. So we have to, that is the importance of managing acute. And moreover, during an acute episode, the victim is going to suffer a lot. So suppose I get common cold today, I will be having a lot of problems, headache, irritation, sleeplessness, and I won't be able to work. I won't be able to do my duties. So these are all sufferings. So that has to be managed with our homeopathic medicine. And
right. So
is
that the first aphorism from Hahnemann, that we want to relieve the suffering of those people?
Yeah, definitely. And moreover, we have to manage the acute with the help of remedies that are free from side effects. That is the importance of homeopathy. You know, friends, nowadays, more than diseases, the drugs are creating problems. Even it kills a lot of people. Our modern medical drugs are killing people more than missiles and atom bombs. People are suffering because of this medical pharmacies lobby. They are marketing a lot of drugs, and these medicines conducting even clinical trials. You know, recently in India, they have conducted a clinical trial and said that it is free trial. But later on, it was declared, it was identified that it was not just it was an illegal, unethical method of trying medicine on human subjects. So like this, even acute diseases are suppressed, and person will come with more complicated disease. So that is the importance of managing acute. So if we homeopaths do not manage acute, automatically the person will go to modern medicine, and they will suppress the disease, and within 1 or 2 months the person will come with another chronic disease or disease affecting the vital organs. So we homeopaths should always give importance to acute disease, otherwise they will manage the case wrongly using medicines that will cause a lot of side effects. That is the importance of managing acute.
Thank you. And do you feel that people in their own home can manage some of these acutes on their own with a home remedy emergency kit?
Yeah, if every time doctors may not be available at every homes. So suppose any injury, we can try homeopathic arnica, hypericum. There is nothing wrong, because every time we may not get doctors available. So at least home remedies can be tried. And you know, there is one dictum: the best doctor is grandmother. So we should respect. We have learned a lot of things from the grandmother. And you know, the things told by the grandmothers, actually it is very scientific. Even though they have not used the modern terminology, these grandmothers were so intelligent. So we have to give respect, but make sure that the disease is not dangerous. Otherwise, they'll keep on giving some medicines one after the other, and finally it will spoil the reputation of the system, as well as the person will lose his life. So at least 1 or 2 remedies, home remedies, there is nothing wrong. But I hate people using paracetamol. You know, my patients, they come with fever, and I just ask, have you taken any medicine? Yes, of course, we have given paracetamol. I said, why you give a lot of struggle to your kidney? Because it's a toxic substance. It will simply suppress the temperature, fever, and you will have a lot of troubles, and your symptoms will not be visible. So for God's sake, don't take all these medicines available over the counter and suppress your disease. So I always advise my patients not to take such medicines as a home remedy. But there is the option. We can try some juices or fruits, water, gruel water, coconut. You know, in Kerala we have a lot of coconut. So coconut water can be tried whenever there is a diarrhea, because it is rich in electrolytes. So homemade ORS. This can be done, but we have to observe. If the case is feeling it's very little beyond the capacity of a mother or a grandmother, it should be referred to a doctor, a person who is trained and skilled in managing that particular condition. So now the aim of acute treatment. The main aim of acute treatment is it should serve the person. It should serve the patient. And the second is it should cut short the duration of sickness. If a person gets coryza, it should not continue for 15 days. It should be cured without suppression. It should be cured within a few hours or a few days. And it should make the person free from pains and troubles. So if he has got pain, struggles, a lot of problems, sleeplessness, give the medicine, make him calm, comfortable. So he'll be having sound sleep. He'll be in a position to do his routine works. He'll be able to take his food and all. So making comfortable. And after giving a homeopathic remedy, we often observe that person feels better in general. That is the characteristic of homeopathic aggravation. In homeopathic aggravation, a person has a little bit more aggravation, even though the person feels better. That is a sign of homeopathic aggravation. Whereas in other aggravation, the symptoms aggravate and person will start feeling very bad because it is a real aggravation. Now, the aim of acute treatment, it should make the person free from pains and troubles. It should prevent complications and sequelae, because a lot of acute complications are observed nowadays. So it should prevent all these complications, and it should not suppress. That is the most important point in management of acute. It should not suppress the disease and strengthen the dormant miasm. So, dear friends, whenever you manage acute case, think about the miasm inside. So if you suppress it, it will come through another route. Again you suppress it, it will go and come out through some other route. So again we suppress it, finally it will burst like a volcano. Along with the internal deranged vital force, it will burst like a volcano, and the person will not be able to manage even with homeopathy.
Explain that again. I kind of missed it. What is going to burst like a volcano? It's going to be overwhelming to the patient to have this strong of an aggravation? I'm not sure I understand.
Yes, suppose one person comes with coryza. I give an allopathic medicine to suppress coryza. The coryza will go away.
Runny nose and something like this.
Yes. It will disappear and the person will have breathlessness, some other complaint. So from one layer to another layer, it will keep on changing and changing. Similarly, the person will be moving from one specialist to the another. So the ENT specialist will suppress the ENT troubles, and now the person will go to a gastroenterologist. He will suppress his troubles. Like that, the person will be moving from one physician to the another, one surgeon to the another, and finally, the person will be a carrier of all miasms along with the medicinal miasm. Hahnemann has very clearly mentioned that treating a miasm is easier than treating a drug-borne disease. Drug-borne diseases are incurable, very difficult. So majority of the person coming to our clinic are these drug-borne diseases. They have a lot of artificial miasms. They keep on taking medicines one after the other, and these medicines can work like an artificial miasm that will collapse the person. So one day the person will burst like a volcano, so he will be having multi-organ failure. All organs, when stops working, there won't be any cure at all. We won't be able to manage such cases. A person coming with renal failure, hepatic failure, and will be having diabetes, nephropathy, or dementia, and a lot of cardiac problems, he will be having, multi-miasmatic cases. So they burst like a volcano because we are suppressing. Small leaks were suppressed, and finally it will burst because it is a Pascal's law. I can compare it with Pascal's law. When pressure is applied, it will be distributed throughout the container. So similarly, we keep on applying pressure from different side, and finally the whole container will rupture like a volcano. That's what.
Okay, it sounds like something.
Yeah. I've compared to the physics.
Okay.
So aim of acute treatment is over. Now, a few misconceptions related with acute. People are having misconceptions, including homeopathy. The first is homeopathy cannot work for acute diseases. The fact is homeopathy cures more fastly and rapidly and gently than any other system of medicine. I am having 10 years practice. Of course, 10 years is nothing. But I get majority of my cases are acute cases, and I manage so wonderfully that just 1 or 2 doses enough to cure majority of acute. Of course, I come across failure, but whenever I come across failure, I discuss with my friends, I refer the cases to my friends, so they manage like that. Because I cannot manage all cases. Of course, I'm a human being.
And are most of your patients already on allopathic drugs? Because if you just give one a remedy one time, or let's say take it 2 times, and then you see the beginning of a cure, and I know that you also use the placebo in between to give a waiting time. I mean, are they on regular drugs or not?
You mean withdrawal of allopathic drugs?
Well, if you just give one homeopathic remedy, will it overcome the effects of the allopathic medicine?
Yeah, definitely. In acute, no, there is nothing wrong in withdrawing allopathic drugs, except some thyroid drugs and some hormones and some steroid drugs. You know, sudden withdrawal of steroids can cause a lot of problems, even death. So we should not immediately, we have to taper these drugs gradually. Whereas we can very strongly, we can very confidently ask our patients to stop antibiotics, stop all anti-inflammatory drugs, all acute drugs. Even hypertension drugs I have asked my patients to stop. There is nothing wrong, but we have to make sure that the general condition of the person is okay for that. Otherwise, we have to consider, we cannot manage all cases. We have to consider the seriousness of some cases. And just select the remedy on the basis of symptoms presented by the patient. So the person may be having some symptoms of a drug he had already taken. It's a part of the drug. But what Hahnemann has suggested, you have to take the whole case, and it may include the symptoms produced by the drug he had already taken. But we have to take this as a part of the acute totality of the person, and we have to prescribe a remedy suitable to that. And I'm very sure if the remedy is correct, the person will be fine. There is no doubt in that. Even a pneumonia, I have cured pneumonia. You know, Debbie, I have cured appendicitis. Acute appendicitis is considered as purely surgical. Of course, in chronic and subacute appendicitis, they give medicines and ask the person to come later. But in acute appendicitis, they ask immediate surgery. But I have, frankly speaking, I have managed acute appendicitis using drugs, depending upon the cases, like belladonna, iris tenax, sorinum, bryonia, like that. I have given medicine and I have cured acute appendicitis cases. So there is nothing wrong in using our medicines in acute emergency situation. But make sure that the person is responding positively, and make sure that the remedy is correct.
Right.
Otherwise, we should not take the risk. Okay? Yes, Debbie?
Yeah, I was going to ask, how long is safe time to wait, knowing, you know, that I know that you trust and believe in your homeopathic remedies, on that you have seen them work positively.
Yeah.
But in cases that someone is treating, and I want to emphasize that Homeopathy World Community and the Health Inn is an educational broadcast, and you're not supposed to be prescribing for yourself. See a professional healthcare provider. That, you know, if somebody is not doing well and they do have appendicitis or something serious, how long before, you know, you need to go into the surgery?
Yeah, it depends. We have to observe. In severe conditions, we have to go for the vital signs. We have to find out the lab reports and all. And suppose if the condition is going out of control, we have to immediately refer the case to a surgeon. Kent has very clearly mentioned, render into things that are surgeons. So we cannot, Kent has compared that. It's a Bible statement in Bible. So Kent has compared that with the homeopathy and surgery. So if we feel that the case has to be managed by surgical intervention, definitely we should refer, because the main important aim of treating a person is life save the life. Hippocrates has said, do no harm. So we should not force the person to take our medicines, only our medicines, don't go for any other system. No, we have no right for that. The life of the person is more important. So we should know our limitation. As a homeopath, what are my limitations? Of course, homeopathy has no limitations, I feel. There is no limitations. But homeopaths have limitations. I'm having a lot of limitations. So I should know that. And once I feel that the case is not under my control, I should definitely refer the case to a person who can manage. There is nothing wrong with that. But we should try, at least once we should try to manage the case. If no result, then definitely refer the case to a person who can manage it well.
And that's why it's wonderful to have a team of homeopaths conferring together and getting agreement on treatment. And I would like to ask one more time if we can just slow down the pace of our speaking. Folks in the chat always have a trouble. So, okay. So now, what page are we on? 17?
Page number 16.
16. Okay.
Yeah. Now the point, another misconception is homeopathy is very slow. You know why people say that homeopathy is very slow? Can anybody tell? There is one reason for that. You know, majority of the people consider homeopathy for chronic diseases. So, you know, chronic disease takes a lot of time to cure because it has got lot of layers. So many layers are there. You have to manage the case one after the other. So, normally people believe that it took 1, 2 or 3 years to cure my asthma. So, homeopathy is very slow. That is only because of this. Whereas a person comes for acute treatment, we can easily manage with the homeopathy. So, homeopathy is very, very fast. Sometimes our mind is not working fast. That's the only problem. But homeopathy is always very fast. But the remedy has to be correct. If the remedy is wrong, then no use of taking homeopathy. Now, another misconception.
Okay, so I think these are really important points, and people in the chat are very excited about it. That basically we consider it slow because mostly people have chronic disease today, and chronic disease has developed over a lifetime, and thus it's going to take time for the homeopathic remedy to undo the damage to the body. Whereas with an acute situation, if you've had a car accident, aconite and arnica and these other remedies will act very, very rapidly to stabilize the individual and then get them to the hospital and to the ambulance. So this is why it's a misconception. Thank you.
Yeah, definitely. And all acute diseases are self-limiting. That is another misconception. Hence, placebo is enough. I have seen many homeopaths saying, self-limiting, why should we give a medicine, unnecessary medicine? No, we should give a medicine, even though it may be a self-limiting disease, but we have to observe. We have to, there is chance for side effects. There is a chance for complications. So, we have to give medicine even to the acute disease, which we feel self-limiting.
Dr. Sharma, can I ask Dr. Sharma, do you have a comment about this particular quote? All acute diseases are self-limiting, hence placebo is enough. What do you think about that?
No, Debbie, I am not agree with the thought that all acute diseases are self-limiting. That is wrong. Many acute diseases are life-threatening, as Dr. Rafiq says. Very good, very true. And we just think about what the condition in the acute disease is coming. Like that, if we are treating a chronic case of asthma, just treating a case of asthma for a long time, for 20 years, and I use a constitutional remedy in between, and then I got a symptom of sneezing, the recurrent sneezing, that will be fine. So that is a positive symptom to just cure the asthma. So you just thought about what is the acute is coming from? Is it coming from your constitutional remedy, or it is just a epidemic disease or any other thing? So if a chronic, that is the more important. If a patient is if a patient is coming with an epidemic flu, then you must need to repertorize it, and you must need to take a very peculiar symptom, 2 or 3 symptoms, and just choose the remedy within a second and just give it. As Dr. Rafiq says, he cures the appendicitis. I share one of my case of 6-year-old boy who is coming with a severe acute abdominal pain of right-sided. Have a peculiar feature of appendicitis. He came from a hospital where the surgery was done in few hours. He just came to me and just asked what what can the homeopathy do in this case? I just said, you just put the patient here and I will cure it. He came with the patient and I just give a single dose of belladonna 200. That is a
Yeah,
single dose,
right.
just for the inflammation, because I always remember the Hahnemann's aphorism: you have to knowledge of disease, knowledge of medicine at every
We
instance.
lost.
So I know belladonna will work definitely.
Thank
Yeah,
you.
acute.
Thank you very much for that
Yeah,
case, in a case example, which we have our producer Amnon flabbergasted saying it's not really, if I have an acute thing like that of pain of appendicitis, I'm rushing to the hospital for the surgery and not realizing that taking the dose of belladonna is going to, while you're on the way to the hospital, you were already on your way to health. So
yeah. We need not waste money for surgery.
by the
You know
time you, yeah, go
that's the
ahead.
main reason why they are against homeopathy, because we are preventing surgeries, we are preventing unnecessary medication, we are preventing a lot of misuse of medicines, drugs, and vaccines. That is the reason why they are against homeopathy, because we are saving the people from side effects, we are saving them from money loss, lot of things. That is the reason why they are against homeopathy. It's very clear.
And this could be seen in diagnostics as well, most
Yeah,
likely. So that over the period of 15 minutes, a couple of hours, you could take a lab test and then see it change.
yeah, definitely. Now, another
Yes,
misconception is
definitely.
need not prescribe for an acute exacerbation. That is wrong. Acute exacerbation is actually a part of chronic disease. But when there is an acute exacerbation, give an acute remedy on the basis of symptoms prominent and then treat with a constitutional drug. That is the correct way.
Yeah.
And another misconception is antibiotic is a must to treat acute infection. Infection means antibiotic. That is the synonym. Even majority of the health magazines, newspapers, media, they are spreading this propaganda that whenever there is infection, antibiotic. Even for viral diseases, they are giving antibiotic. I don't understand the meaning of that. Viral disease, they spread, they keep on giving antibiotic and say that it is to prevent the secondary infection. You know, for every mistake, they have explanation. So whenever there is viral infection, they give antibiotic and say that we are giving this to prevent secondary infection. So wrong way. Antibiotic infection, any infection, it may be viral, bacterial, or protozoal, or fungal. We have remedy. We can manage. I have managed hundreds of infections even without antibiotics. Of course, in surgery, whenever the person goes for surgery, normally more number of bacteria reaches the body. So we will have to allow the surgeon to prescribe some antibiotics. That may be needed, because in surgery it's too much involvement of bacteria directly goes to the body. So within certain limit, when beyond some limit, when there is infection, we have to allow the allopathic doctors to prescribe. I don't say that antibiotics is not needed. I don't say unnecessary. I am against the use of unnecessary use of antibiotics for infection. Okay.
Can I ask a question about, let's say a person is having a lot of dental surgery and
Yeah.
somebody has infected gums and pyorrhea, and they're scraping these gums and it's all full of bacteria. This is going to go to the heart through the circulatory system, and this is why they give antibiotics to protect the rest of the body and the organs from an infection, which they're actually, by scraping, they're moving it around and releasing it into the body. Do you have a comment?
Yeah, by doing that, there is chance that there may be some infection. Even dental carie can affect the heart. There is scope chance for subacute bacterial endocarditis. Even a dental carie can cause pneumonia. It can cause general infection. It can cause septicemia. But we have medicines. Whenever I have some patients who are very sensitive to allopathic drugs. Yesterday I had a patient. She is very sensitive to allopathic drugs. Even some mild antibiotics, she will be having a lot of problems. So I have one very close dental surgeon. He's my very close friend. He's in fact sometimes he comes to me for medicine. So I just contacted him and I said that I will give some homeopathic medicine. You do dental work, remove the teeth. So he agreed, and I just gave some medicine. I have given Creosote 200 to her, and she's okay. Today evening she called me and she's feeling better with no, there is no pain and there was no bleeding at all. So we have a role, we have our own role. There are some areas where homeopaths can work together with allopaths. I don't say that allopaths are against our system, they are our enemies. No, they are our friends. So there are some areas where allopaths and homeopaths can work together. You know, in hospitals, in post-operative wards, we can manage some cases, side effects of anesthesia. We have medicines like phosphorus, acetic acid. We have medicines, Moscus, lot of medicines we have. So there must be a facility for homeopaths to work together with these allopathic friends and for the benefit of human beings. That has to be. But unfortunately, there is clash between different systems of medicine.
So, Dr. Rafiq, this is Amnon. To follow what Debbie was saying, is there if you go to the dentist and you get it scraped and there's a chance of infection and then you're going to have to take some, is there something homeopathic that you can take before going to the dentist, anticipating that this is going to happen?
Yeah, there is one medicine, Rustox is indicated. Before going to a dentist, we can give Rustox. Another medicine is phosphorus 200. If we give phosphorus to a person before going to a dentist, there is less chance for bleeding. So we can give the drug I have just told, Creosote, to a person. So depending upon the situation, what type of surgery is going, and we can even use drugs like calendula for gargling and all. That echinacea. Echinacea is a homeopathic drug that has got antiseptic properties. So we can use these drugs as for the prevention of infection. And you know, hemamelis. Hemamelis can be used for prevention of bleeding and hematoma. It will prevent hematoma. So hemamelis tincture can be kept in a cotton. It can be kept in the mouth, and that will prevent hematoma. So homeopathy has got role in each and every aspect. Only thing is there has to be a good communication between homeopaths and other systems of medicine. Only that is needed. For the benefit of patients, we homeopaths can do anything we can do. We can support them. Of course, we have limitations. We have to admit that. That's okay.
Okay, slide number 19. Why treating an acute is a challenge?
Challenge, yes. Why it is a challenge? Because person is in trouble. An acute person is having, first of all, his day-to-day activities there is a breach in his day-to-day activities. He is in trouble. He is in agony. So he needs quick relief. Without quick relief, he will go to another physician. Mostly another system of medicine. So it is a challenge before us. We have to make him comfortable very quickly. That is the first challenge. And the second challenge is acute is life-threatening, some acutes. So we are dealing with a life-threatening disease. So that is another challenge. We have to manage that. And the third is there is no sufficient time for recase taking. You know, in chronic cases, we can ask our patient, okay, come next week, I will take the case. And we can discuss the case with our colleague. We can post that in discussion forum and take their valuable opinion. Whereas in acute, we don't have time for that. So we have to be very quick. We have to manage the case as soon as possible. So the time is very less. And another challenge is patient may leave our treatment. So we have to manage the patient. Now page number 20, selection of a correct remedy is a challenge before us. You know, in homeopathy, if you see the repertory, in fever, hundreds of remedies, headache, hundreds of remedies, abdominal colic, hundreds of remedies are mentioned. So we have to select the most suitable remedy. So that is a challenge. It is not an easy task to select the simillimum. It is very easy to say theoretically, but practically selection of the suitable drug is a challenge before each and every homeopath. So I have mentioned that as a challenge. We have to do it successfully. And another challenge is we need to compete with the other schools of medicine. Modern medicine, Ayurveda, and other systems are there. They are also managing acute diseases. So people will compare our system with modern medicine. Ordinary people, what they think, whether I am feeling okay or not. That is the first thing considered by the public. So whenever they come to homeopathy, they will think, I am okay or not. If not okay, they will go to another system. So other system, people are advertising, people are creating wrong propaganda against our system. So that is a challenge before homeopaths. And another is disease diagnosis is a must, not only for the legal aspect, medical legal rules, even for the remedial diagnosis, sometimes disease diagnosis can help. But Hahnemann has very clearly mentioned there should not be a specific remedy for specific disease. Hahnemann was against that concept. But we can think about a group of remedy. From that, we can select the best simillimum, the most suitable simillimum, considering the individual features. That is the difference of homeopathy. We have to consider the individual features of the person. Now, case taking in acute, page number 21. Case taking in acute, the first thing is direct interaction with the patient. I get many patients, not the patients, parents will come. Father will come and say, my child is having cough and fever. Give me medicine. How to prescribe? An allopath can easily prescribe. Here's one or two choice. But a homeopath cannot prescribe. So always prefer direct interaction. Suggest the patient to bring the patient, the parents to bring the patient and have a direct interaction. Because the father can give only the common symptom. Cough is there, fever is there. If you ask about the thirst, if you ask about the thermals, he may not be able to give details. Of course, mother can give little bit more things about appetite, thirst, activities and all. Whereas father may not be able to give the details. So the first thing in case taking in acute is direct interaction with the patient. And if person is not in a position to move, at least we should go. If you read other history of homeopathy and all, we often see our pioneers, they used to go for home visit. Nowadays, doctors do not do that. So go for home visit, go to the patient's room and just see how the person is lying and we get the clear picture.
I can't imagine, Dr. Rafiq, in America, a doctor is usually given, 5 or 15 minutes per patient. And I can't imagine the physician traveling to the home visit. I remember when I was a child, my doctor came to my bedroom and saw if I was sick. And I don't think that they do that, at least not in America anymore. So that is a beautiful way of taking care of the patient and knowing who they are.
But I go at least once or twice in a week. I go for home visits.
Unbelievable! It's really a beautiful thing. And so also it's important then to educate and train the family and the parents or guardians how to observe and write a written journal, a diary of what they observe, and that way they can give more information that is helpful to you.
Yeah, I know Dr. Adil. He always asks his patients to maintain one diary. And every day the person is asked to write down whatever the feelings, morning, evening, whatever the things, almost like proving. And it really helps. So I suggest my friends, ask the patient to keep a diary and ask them to note down what are the things when they had vomiting, when they had food, when they had diarrhea, what are the feelings. Almost like proving, what we do in proving. Make a note of that. So whenever they come for the next visit, it will give more information. We will get the clear picture of that. That's a good idea. Now we are coming back to the case taking. And in acute, causations are very definite. Modalities and concomitants are very prominent in acute. And patient can provide the strongest, striking and troublesome symptoms in acute. Whereas in chronic, patient may not give all details because he gets habituated, adjusted with the situation. So he may not give the details. Whereas in acute, we get everything. And in acute, we have to target the presenting complaint. You know what is the presenting complaint? The complaint that has brought the patient to us. You know one thing, if the person is not feeling better, if the presenting complaint is not better, he will go back because the symptom that brought the person to us is not relieved. So the same symptom can take the person away from a doctor. Got it? So the presenting complaint has to be considered. So the presenting complaint has to be targeted. And another is consider the recent alteration and altered dispositions in acute. And consider the onset, duration, progress, and the order of appearance from which system to another, which system is started and to which system is shifted. We have to consider that. And in case taking, another is, so symptoms should be complete. Try to make the symptoms complete, but not forcefully. I've seen some homeopaths forcing the person to give the answer. No, never. You should not force the person. Otherwise, we are going to get only the forced symptoms which may not give the correct picture. But try to make the symptoms complete by noting down causation, location, sensation, modalities, and concomitant, but without any force. And another is exciting causes. What are the exciting causes? Like it may be a mental, physical, emotional, environmental, or sometimes the patient will hide it. So better have an interaction with only with the person. Ask the bystanders to be outside, and they will give the exact reason for the troubles. And on that basis, we can prescribe a remedy, and it will definitely work. So I have experienced that person hide a lot of things, but finally they told the main exciting cause, and the remedy was given on that basis, and it got cured. So I have written a blog on Homeopathy World Community there about that. And another is exciting causes I just told, and PQRS given by the patient, peculiar, queer, and rare symptoms given by the patient, or even observed by the physician. Sometimes we can observe PQRS symptoms. And another is altered generals are more important than basic characters. Friends, there are some basic character. Each individual has got some basic character, but do not consider it while taking a case in acute cases. You consider only the altered generals. Altered generals are more important, and look for absence of expected symptoms. Suppose a person having severe infection, and if he says that I have no pain, normally whenever there is infection and swelling and all, there is possibility of pain. But if no pain, then it is a peculiarity. So we can consider drugs like arnica, hellebores, hyoscyamus, or even ignatia. In ignatia we get lot of contradictory symptoms. So we have to observe, look for the expected symptoms. And another is never mix acute picture with chronic picture. Dr. Kent has very clearly mentioned that whenever you take case, do not mix acute and chronic picture, mix together and prescribe. That is wrong method. And another is, in acute episode, the constitutional drug is not homeopathic. You give the acute remedy and later on think about the constitutional remedy. And always take the past history to know any suppression or any exteriorization.
Can I ask you what slide are we on right now?
It's 25.
25. Okay.
Yeah. So past history, take the past history and history of suppression. There may be, suppose a person comes with eruption, it may be an eruption that is coming out after our treatment. So the person had the same in the past that was suppressed. So we have to observe that and do not interfere. Let the eruptions go, and we have to watch peacefully without any interference. Okay, that's the importance of history. And another is, we have to consider whether it is acute or acute exacerbation. Acute exacerbation is a part of the chronic disease. It is not an acute disease. It is a part of chronic disease. But even in acute exacerbation, give a remedy on the basis of totality, acute totality, and later on follow up the remedy with a constitutional remedy or the anti-miasmatic remedy, or even a nosode. If the case goes out of control, consider a nosode that is related to the pathology that can give relief. And later on we can consider the constitutional remedy of the person.
Okay, now, that is quite advanced prescribing, and probably at another time we will answer questions concerning using nosodes within the acute situation. because I think we're just going to gloss over that right now. And I want to let you. I'm sorry. I want to let you know that it is 12 o'clock here, so it's an hour. We will go for another 30 minutes if you're available to stay.
Little fast.
No. I don't want to go fast. I want to go nice and slow and let people hear and comment and ask questions. And people can call in to 919-518-9773 in the United States or on Skype at Computers 2K Voice. We will, since we have 60 slides and we're on 25, we can continue on a continuation of this show on Blog Talk Radio at another time that we will schedule on the calendar.
Okay. Even you can share the PDF with the public.
The PDF is available right now on Homeopathy World Community. Click the banner to the show, and it's there. Okay. And so just take your time. Don't feel rushed at all. Thank you.
Okay, now the next slide is why clinical examination. You know, many people say, these homeopaths, they just sit away from the patient. They keep on talking. They don't touch the patient. You know, touching is very important in medicine. If you read ancient textbook, different ancient textbooks are there. These prophets and all, they used to touch the patients and they cure them. So touch is very important. Whenever you take the case, touch the patient, feel the warmth, have a shake hand, and just transfer the energy you have with the patient. And examine the patient. Always examine. There is a common complaint that homeopaths do not do clinical examination. Never. We homeopaths should always do clinical examination. And apart from that, not only for the disease diagnosis, clinical examination, proper examination can also help for remedial diagnosis. Why? You open the repertory and see there are many rubrics, hundreds of rubrics that can be selected only by doing clinical examination. Even in Kent's repertory, if you open, there are several rubrics. You can select those rubrics only by clinical examination. So clinical examination is very important. And
I've always been intrigued by the ones where they're looking at the urine, whether there is a color change or some deposits in it or viscosity. I've always been fascinated by those. And then there are also homeopaths I've read who will, when they shake the hand when the person comes in, they will note right away whether it is a moist or dry or what kind of handshake, whether it is a weak or strong. And these things are all important observations, that information that is being given to you as a physician.
Yeah, definitely. And it gives confidence to a patient. Patient will feel that, yes, doctor has examined me everything. He has diagnosed my disease. So it gives confidence to the patient. So always do not only prescribe medicine. Always take the case, do examination, and then you prescribe. And whenever you do clinical examination, follow the Hahnemannian schema from head to foot, and then you have to go from system-wise. Now, another important is give importance to inspection, palpation, percussion, auscultation. Inspection, I have another, I will just post that in a blog, as a separate blog. Inspection, palpation, percussion, auscultation. And these are the different steps we follow in clinical examination. And the most important thing is, whenever you do clinical examination, do not hurt the patient. Do not create the troubles more, and make him comfortable. And always take permission from the patient. Before touching the patient, make permission. And if the patient is a female, always do clinical examination only in presence of a nurse or a bystander. That is very important. Now, the 29th page is why lab investigation. Again, lab investigations needed for disease diagnosis and to assess the present health status and to know the pathology. And I forgot to mention one point here, even for rubric selection, lab diagnosis help. You just open Kent's repertory and you can see a lot of rubrics that can be selected only by lab diagnosis. So do lab diagnosis and select the rubric. Of course, we should not give over importance to those rubrics. But consider those rubrics as a part of the individual picture. And to assess the progress of disease, prognosis of the case. So if the person is dying, we can uh, immediately tell the family members that the case is going to die. Of course, do not tell the patient directly, but we have to give, because we are living in an area, in an era where medical legal issues are very active. The people are more aware about the medical legal issues. So we have to always take precautions. So do diagnosis and effect of treatment, assess the effect of treatment, whether our treatment is good or not. So whenever you manage a diabetic case, do HbA1c, glycosylated hemoglobin. So that will give the effect of treatment. In the past 3 months, how the patient behaved, how the diabetic level of the blood sugar level was during my treatment. So that will give the result of my treatment. So we have to always follow lab investigation. Apart from that, lab investigation helps for statistics and evidence-based medicine. Nowadays, whenever we cure a case, people will ask, I need evidence. Without evidence, no use. We cannot manage. I had a case of thyroid enlargement, but unfortunately, I did not take the picture. But now the swelling is almost gone. Only slightly visible, but I have no evidence because the initial picture is not there with me. So we have to take all precautions. We have to provide all data, save all data, images, investigation reports. So that will make our presentation more scientific, more authentic, so that it will be accepted by the public. And lab investigations also help. It will give confidence to the patient. Suppose a person is having high fever, refer the case for a blood investigation, and person will stay with us at least for 2 to 3 days, because doctor has done an investigation. So they will wait for the result of investigation. Otherwise, if you do not do investigation, they will go to a physician. I had a lot of failures because of that. But nowadays, I do. Whenever the symptoms are not relieving, I refer for the investigation, and the person even the patients feel better, because we are diagnosing the disease. We are scientific prescribers. We have to be. And why disease diagnosis? Disease diagnosis helps for selection of a group of remedies. It will not point one drug, but it can sometimes help for the selection of a group of remedies and selection of mode of approach. Suppose a case is diagnosed as multiple myeloma, we can think about palliation. So whether to give curative medicine, whether to give palliative medicine, or whether to give preventive medicine, so that family members can prevent the infection, we can prevent the infection. So the mode of approach mode of approach depends upon disease diagnosis. And even for selection of rubrics, selection of potency, selection of diet and regime, and medical legal issues, and diagnosis is also a prestige issue. Suppose I diagnose myocardial infarction and refer the case to a cardiologist, I will get the credit because I have diagnosed the disease. Even though the case is managed by a cardiologist, I have diagnosed the case, so I will get credit as a physician. So diagnosis has got its own importance, but the most important point is, whenever you diagnose, it should not wrongly influence your remedy selection. Remedy selection should be done considering the totality. That is most important. You should not blindly go behind the diagnosis. That is most important. And now, repertorization in acute. There is a wrong notion that repertorization is needed for only chronic. No, even in acute, because in acute there is chance for rare remedies, unknown remedies, and there are rare rubrics, single remedy rubrics. We can select a remedy on that. So repertorization is very useful in acute, but only thing is, whenever you do repertory, do not add the basic characteristic of the individual. Do not add the chronic features of the patient to the repertorization chart. You take only the acute totality, and then you select the acute remedy on that basis. That is the most important thing. And even in Kent's repertory is considered as a general repertory. But even Kent has mentioned a lot of particulars. If you see the extremities chapter of Kent, you can see a lot of particulars he has mentioned that can be selected, that can be used for acute ailments. So always use repertory. Of course, whenever you are prescribing a bedside case, then there is no scope for that. We can consider the material medical knowledge and then prescribe. Now, methods to manage acute.
Tell me what slide are you on right now?
34. Methods to manage acutes.
Okay.
Yeah. Basically, there is only one method. Take the case, select the similimum, administer, finish. That is the only one method. But confusion may arise due to many similar drugs, seemingly indicated drugs, and different levels of similarity, and symptoms overlapping. So we get confused sometimes. We are human beings, so we get confused. So, but a true physician can easily distinguish a similimum from a group of similar drugs. So Hahnemann has very clearly mentioned, repeated use of a partially similar remedy is very dangerous. A partially similar remedy, if repeated too much frequently, it can spoil the case. So do not do frequent repetition if you feel that remedy is not fully similar. And more than that,
how do we know this? How do we know if it's a partial similar and not right on?
Yeah, it's very easy. We take the case and we select the drug which covers maximum symptom. And if we go through the materia medica, we feel that the remedy does not cover the totality of the individual, whatever we have. So we feel that even though it is not the similimum, it is partially similar, and whatever the remedy we have, that has to be considered. So if we manage a case of acute infection, chest infection with fever, sometimes bryonia feel partially similar. So there is nothing wrong in giving 1 or 2 doses of bryonia, but not frequent repetition. Because if the case is partially similar, frequent repetition will spoil the case, and the chest infection, definitely it will go into bryonia. Pneumonia, not bryonia, pneumonia. So always take care, do not frequently repeat the partially similar remedy. And confusion, I just mentioned about the confusion arise because of different levels of similarity. So these are the areas. So we have a few ways of drug selection in acutes. Of course, the similimum is the right. If similimum is not clear, we can consider a few methods. There are drug selection on the basis of causation. So a person comes with injury, we can consider drugs like arnica, natrum salt, hypericum, like that. An emotional problem, we can consider remedy like ignatia, acute of natrum. We can consider staphysagria, like that. So causation has its own value. Another is climatic remedy. So sudden change of climate, we can consider drugs like bryonia, restox, delcamera. So climatic remedies usually help for practice. And another is PQRS. So we don't have the clear image of a remedy, but person has given a PQRS of one particular remedy. So we can give that remedy that will manage the case. And another
we're speeding by, and a lot of people who have never heard of homeopathy in their life are going to look at PQRS and many of the other shortcuts that are used and not know what that means.
PQRS means peculiar, queer, and rare symptoms expressed by the patient. These are unique to the individual patient. Unique means it's not seen in almost all patients. The person has got, in homeopathy, we give a lot of importance to the PQRS symptoms. And the drug selected on the basis of PQRS symptoms, of course, if there is no contraindication for that remedy, it will definitely cure the case. Hahnemann has given great importance to PQRS symptom. So we can select a remedy on the basis of PQRS symptom. And another is acute drug of the chronic remedy. For example, the person is a calcarea patient, but she comes with an acute infection, we can consider belladonna. Similarly, a natrum person comes with emotional problem which looks like an acute phenomenon, we can consider ignatia and later on give the chronic remedy. So that is a method of prescribing. And another is keynote prescribing. You know, Allen's 3-legged stool is very famous, keynote prescribing. And another is favorite remedy, of course not homeopathic way of prescribing. Favorite remedy, specific remedy, routine remedy, and considering some clinical tips. Of course, these are not followed by classical homeopaths, but when our classical medicine, when the medicine selected on the basis of classical homeopathy do not give any response, then we can definitely consider clinical tips. We can consider routine remedies, because if we go through the history of homeopathy, we see a lot of people, lot of pioneers have followed. They had followed such type of approach in difficult cases. It can cure. And another is organ remedy. Yeah, Dr. Burnett had managed several cases considering the organ remedy. So there are different levels of similarity. So first we have to consider simillimum. If no simillimum is clear, then we have to go for the other levels of similarity and give the remedy. It may be a pathological similar. You know, we homeopaths should have a broad mind. We should consider at the present state what is the level of the patient, what is the vitality, and give a remedy similar to that particular moment, and later on think about the chronic remedy for the totality of the individual.
We have a comment in the chat by Subho who says Herring's three-legged stool.
Yeah.
So we have three solid foundation points to stand on.
Yeah, without 3 legs, a stool cannot stand. So there has to be minimum 3 keynotes so that we can easily prescribe a remedy. S.K. Banerjee has said MTech, miasm, essence, totality, like that. He has made a formula. On the basis, if you give a remedy, it will definitely cure, which also includes totality, keynote symptoms.
Totality and another method. Keynote. Okay.
Yeah.
Thank you.
Yeah. And another way of prescribing is alternation of related remedies and indicated remedy along with some biochemics, tissue salt combinations. Of course, I do not follow these combinations, but I have just mentioned different methods of prescribing. And another is drug selected on the basis of some 1 or 2 common symptoms, because we don't have much symptom, or the patient has not come, only the parents or bystander has come, and we don't have symptoms. So on the basis of common symptom, we give remedy. So it may work, but it may not work. So always tell the patient that next time ask the patient to come so that we can give a better remedy. Now, some practical tips on acute, page number 37. Repeated symptomatic treatment can make the miasm stronger. So avoid repeated symptomatic treatment. Once the acute episode is over, take the totality and consider the individual as a whole. And another point is, do not start treatment with constitutional drug in acute. In acute, start with acute remedy, then go to constitutional remedy. And another is unnecessary repetition of simillimum should be avoided. Of course, we should avoid the partial similar drug, and similarly avoid unnecessary repetition of simillimum. If the drug previous dose is already working and person is feeling better, stop the remedy and just observe. Give placebo frequently. There is nothing wrong, because too much repetition will make the susceptibility spoil. It will spoil the susceptibility, and the remedy may not work. The case may fail. So always patiently wait and see. I just mentioned in the starting, homeopathy curing a case is like catching a fish. So we have to wait patiently and observe the patient.
Do you use the Organon 6th edition of a water potency that you are every day succussing so that you're actually changing the resonance and the potency? That way you can repeat safely?
Yeah, that is much better. LM potency. In aphorism 6, Hahnemann has mentioned every second dose should be of higher level. So shake every time before the administration, give the water dose, shake the water doses, so there won't be any medicinal aggravation, there won't be any side effects. So that is very useful, especially while giving LM potencies. Even in centesimal potencies, especially when we manage bedridden patient. Yesterday I had given arnica to a bedridden patient, arnica 30 in water, and I just asked them to shake every 10 times before every medication. So now the patient is okay, but the case is very incurable case. Still he is feeling better now. So we can follow that type of administration. And suppose there are many patients, they need medicine every half an hour. In fever and all, they need to give medicine every half an hour. So we can manage. Give simply placebo and ask the patient to take this placebo every half an hour. There is nothing wrong. And give the medicine, indicated medicine in 1 or 2 doses. And we can give morning or evening 1 dose like that, depending upon the case. But give the placebo for frequent repetition so that patient will be happy.
We have a question in the chat, Dr. Rafiq. How frequently, the question is, how frequently do you change the remedies in acute cases if you need to change them at all? I guess what she's asking is, do you wait a full day to see a result happening with the remedy, or how long will you wait?
No, I don't wait for a day. I don't wait for a few hours. Suppose a person comes with a fever, I give Natramur, 1 dose, 30 is given, and I just wait. And I always ask the patient to call me after 1 or 2 hours. And if no relief, then I ask the patient to come to send somebody, and I give the medicine. But not always. I give frequent repetition in certain cases. So depends. If no relief next day, then definitely I change the remedy. I don't immediately change the remedy. Not in all cases. So the case only decides the approach, what type of case, what type of response we get from the patient. That is why it is said homeopathy is an art. The case only decides what? The case only decides the remedy. The case only decides the potency. The case only decides the repetition. So every case we should observe. There is no standard you have to do every 2 hours. No, there is no standard method, standard way of application, because we have to, homeopathy is an individualistic method. We consider the individual. So observe the patient. If he is feeling better, then stop the medicine, ask them to take only the placebo without telling that it is placebo. That is more important. Then if okay, then stop the remedy, and we can ask the patient to come next day, just go for routine examination. If he is okay, then let him continue the placebo. Otherwise, if symptoms are, sometimes the patient will say that I'm okay. But when we do the examination, his clinical findings, his lab findings are horrible. So we should not only rely on the words of the patient. We have to examine, we have to repeat the test. Suppose the platelet counts goes down, so we have to take the case seriously. So do not only go behind the words of the patient. We have to observe, we have to examine.
Right. I was thinking, like, if it's a dire case, then you have to be on top of that case all the time to see that you're going in a direction of cure, in a good movement forward. Because if you're not seeing that, then you do have to reevaluate what's going on in the moment. Dr. Sharma, did you have something to contribute?
Yes, Dr. Rafiq, you are just teaching us about the acute case, treatment of the acute cases. But I, in my...
Yes, doctor, tell me please.
We're losing sound. Okay. You know what? We have a short amount of time left, so I think if we can possibly finish some practical tips on acutes, which would be the last of these 3 slides, and then we will continue the show on Blog Talk Radio at another scheduled time, because this is a really great program that you're giving us today, and we've got a lot of information to absorb here.
So, and I have 2 cases. Can I take one or 2 minutes for that? 2 cases.
Sure. Why don't we just jump to the cases and
54, page number 54.
Okay, so let's Dr. Sharma, are you able to connect? Are you there?
Yes, I am here.
Okay, go ahead.
Page number 54.
Yes.
It's a subconjunctival.
Okay.
Go ahead, Dr. Rafi.
Consulted
Go
me.
ahead.
He had an injury, blunt injury, and he consulted an ophthalmologist. He prescribed some medicine and said that it will
Talk
take
slowly.
20.
Talk slowly. I'm not able to catch a word you're saying.
Yeah, the person RM, he had an eye
54.
injury, blunt injury, and there was subconjunctival hemorrhage. And he consulted an ophthalmologist and he prescribed a medicine and said that it will take minimum 20 days to recover. But he consulted me and I prescribed Ledum 200 and just see the result. Even I could not believe that it's such a wonderful cure because next day he called me that, doctor, I don't find the signs of injury. And he is a person, he worked in defense and such a high level person. So he thanked me like anything because he was unable to move. He had a lot of troubles and his family, his children all were in agony because of just have a look at the red eyes. So, but after homeopathy, friends, Ledum 200. I don't say that Ledum is specific for that, but Ledum worked. Other remedies like symphytum, arnica, etc. There are many other remedies. But in this case, Ledum worked magically and it cured.
Right.
Now,
I remember, I believe you posted this onto Facebook, and you were asking all the other homeopaths what remedy would be appropriate. And we think about the typical remedies that are organ specific, like aconite is like the arnica for the eye, and symphytum for the eye, and some of the other remedies. But you're thinking, we think about Ledum as a puncture wound remedy, and yet it was used here with success. And what was it that brought you to this remedy?
Pardon?
What was it that suggested to you that Ledum would be the ideal remedy for this particular case?
Of course, there were no characteristic symptoms of Ledum, but I consider, of course, a few remedies like arnica, symphytum, Ledum, etc. came to my mind. And for black eye after injury, of course, Ledum has its own value. So I immediately considered Ledum. And sensitivity, pain, everything was there. But, arnica, I had a lot of failures with arnica, frankly speaking. I don't say that arnica is a wrong remedy, bad remedy. Arnica has its own value, but the case has to be arnica. It has to be similar to the arnica in totally, even in the mental level. But luckily, in this case, Ledum was similar and it worked magically.
It did.
And I did not repertorize this case because such emergency cases, I just did without repertorization. I do repertory whenever I get the details and I have little bit more time because busy practice when acute cases are more now, we don't have more time, so I just prescribe. Of course, I don't say that repertorization is not needed, but it is needed. It will avoid confusion. It will give the correct remedy. But sometimes when acute case comes, immediately we feel the remedy because our mind can very clearly indicate. So when no confusion, then why should we spend time for other methods, other tools?
It takes 10 years of experience to know with thousands of cases that you've taken.
10 years, nothing in homeopathy. Even after 40 years, people are still studying. I have seen many senior-most homeopaths studying like children. They even ask doubts, even to junior like me. So all our homeopaths are students throughout our life. There is nothing like experience. All are same, I feel.
Well,
now
keep the curiosity. Okay, we have one more case study, and then
55 an acute non-healing wound cured by homeopathy. And a person S is an optometrist. He's working in an ophthalmologic hospital as a lens specialist. And he had an injury and there was bleeding and stiffness was there. And there was slight cellulitis, even though it was not so severe. But his knee joint was very stiff and the bloody pus was moving out. And even after 7 days medicine, there was no relief. So he consulted me and I just felt that joint, it's not so active like an acute cellulitis. So I considered the silicea because silicea, the ulceration when you feel it, we feel it very cold, like. So I prescribed Alicia 30, and the same day he felt better. The pain was gone, and the healing was there. And I've just taken the picture afterwards when he came for consultation. But the picture is not on the third day. He came actually on fifth day of treatment. But he said that on the third day itself, the wound was healed and the bleeding was stopped. The pus was there was no pus at all. So it was these two cases. I have many cases, but we don't have time. So shall I conclude, Debbie, now?
That would be perfect. Unless, can we ask Dr. Sharma, did he have something to contribute? Did you have a case or something? Are you with us? No sound. Okay, let's do.
I have many cases. Yes.
Sharma is a doctor now. He has a lot of cases.
Go ahead.
He often cases. Now conclude. Friends, homeopathy is criticized because of lack of scientific proofs. The most effective way of proving the efficacy of homeopathy is successful management of cases. Friends, when a person is critical, he may not come for medicine for his chronic complaint. He may come for his acute complaint. So he will have an headache and give medicine, cure it, and he will have faith in homeopathy. So my dear friends, today that is my message. Try to cure each acute case you get. Make them comfortable. That is the best way of propagating homeopathy, because the words of the patient is more important than the words of the scientist. So these scientists may not give full approval to homeopathy, but these patients can give. So this is my message today. Try to cure each case you get, each acute case with suitable homeopathic remedy. Make them comfortable. This is a very busy life. People don't have time. So give them time. Just cure them and make them comfortable so that they can continue their work. So that is the charm of homeopathy. That is the beauty of homeopathy. So that is my message today. Try to cure each case, each acute case. So tomorrow he may come with his totality so that we can continue. Of course, our aim is to treat the whole individual with the constitutional remedy, but not today. Whenever he comes, make him comfortable. Next time, cure him using the constitutional remedy. So that is my message today. So we must start treating coryza before we start curing cancer cases. So cough, cold, coryza, these are all not silly things. We have to manage such cases, and gradually we'll be able to manage other chronic cases, complicated cases. So beginners can always concentrate on acute diseases and manage such cases. And I would like to thank Debbie Brack and Mr. Amnon from Nissan Communication and Dr. Sharma and all other members of Homeopathy World Community. I should not thank all my HWC members because I am part of that. HWC is inside my heart. I'm the part of HWC. So all are like my brothers and sisters. So still I have to do this for the sake of formality. So I would like to thank all of you and all doctors online from different parts of the world, all homeopathic brothers. So keep united for the sake of homeopathy. So we have to grow together. We have to work together for the uplift of our system, popularity of our system. So always be in touch. And thanks for watching. Thank you. Yes,
okay.
Please, Debbie.
Yeah. That's such a stimulating, robust conclusion. I know Amnon is smiling from ear to ear as we preach our method and knowledge and confidence in homeopathy through, you have presented so much information in a short amount of time that the toolbox, the medical toolbox for the homeopath is vast and wide, covering all the different methods of treatment, including using mother tinctures and placebos and cell salts and all of these other things. It is a lifetime of study. I think Amnon...
I'm going to have to buy a bigger box now after today.
Home remedies.
Well, we do have a lot up our sleeve here.
Yeah.
So, this has been such a wonderful presentation. Everybody has been excited to hear you speak today.
Thank you.
I want to, and maybe give the policeman some cookies or cake or something on the way out.
It was really wonderful.
Dr. Sharma, he's been hanging in there in the ether with us and didn't get a chance to present a couple cases too. So our time has flown by. I want to let people know about the upcoming shows because I've been filling the calendar for the whole year of 2013. And if you have suggestions for possible speakers, guests to be interviewed, let me know at homeopathyworldcommunity@gmail.com. Next week, February 25th, Iman Nawab, our resident historian who has provided so many wonderful photographs, he's going to talk about the human body's tune-up maintenance, and I think he's going to expand our toolbox. On March 4th, everybody's very excited to hear Senya Avram. I need to change that last name there for astrology and homeopathy. March 11th, Dr. Navneet Badani, psychiatry in understanding childhood depression. And then on March 18th, Stephen Lewis is going to talk about energy medicine, the AIM program for energetic balancing. Upcoming this week, we continue with Homeopathy World Community scheduling on Blog Talk Radio, and we will schedule a time for you, Dr. Rafiq, to be on the show. On Wednesday at 10:30 a.m., Dr. Adil Chimtalawala Kasim will be talking doing a special dedication on the honor of his parents' birthday, and both of his parents are dedicated homeopaths. He's a fourth-generation homeopath himself. On Thursday from 1 to 2:30, please note of the time change, we have been partnering with Freedomizer Radio, and which means that our message is getting out to many more thousands of people. Alan Phillips, attorney at law, talks about vaccinations and your rights in America. And I will be speaking at 2:30 to 3 about the mind-body-skin stress relationships. And it's very fascinating what I have recently learned. And I want to give my thanks. I'm kind of so full of gratitude to everyone, to Dr. Rafiq, to Amnon, who is always with me, the co-host, Dr. Deepak Sharma of the Orbits Clinic in New Delhi, all of our viewers and members. Contact us at Homeopathy World Community on Facebook and on Twitter. Yay, we did it. Okay.
See you. Yeah, okay. See you. Good night to all of you. Bye.
Thank you.
Bye-bye.
Bye-bye, everyone.
Bye-bye.
Thank
See
you.
Have a good
Thank
day.
you so much.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Sundays 9 a.m. till noon. Carrie's Psychic Cafe with Carrie Silkowski, Sundays 8 till 9 p.m. Health In with Debbie Bruck, Mondays 11 a.m. till noon. Breaking Free with Marilyn Shannon, Mondays 8 till 9 p.m. One Chic Mama with Mary Michelle, Wednesdays 4 till 5 p.m. Reawaken Your Brilliance with Julie Seibert, Wednesdays 9 till 10 p.m. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by thatvidblasterguy.com, carolinaapparel.com, and deltaforce.net.